I'm still here 17. I'm still here 17 years later, happy to have all of the PANDAS Network families here with us. And, I was able to meet you, Warris, Dr. Bokhari, quite by surprise a couple of months ago, month and a half ago, because you were approached by a PANDAS family. I'd never heard of your organization, which is like the modern Robin Hood of the American medical system. So I'm so happy to meet you and would love to hear your story about how you got started with our community.
Sure. Yeah. No, nice to see you all, and some familiar faces here in the attendees as well. So, you know, honestly, it's been a very warm and welcoming community to be a part of, which has been just great for us as we tried to produce a solution that we think helps. Where this all started for me, I grew up in England, in a very working class family. I say this with I don't mean this to sound disingenuous at all, but both my parents were disabled, so we grew up with not a lot of money around. I also, for that reason, got to see a lot of what it took to live with chronic disease. That inspired me eventually to go on to medical school and train as a doctor. And these are all opportunities, as it happened, that wouldn't have existed had I lived in the US. And so, as I kind of traveled through US healthcare, and I'd worked around, all of the big companies from Apple through Amazon, and then I worked at an insurer at Anthem, you start realizing just how unequal it all is and how really nothing's guaranteed. I got very interested in how American healthcare works / doesn't work, and also the people who have been badly left behind. So like this issue of denials had been something which I found just utterly alien to me, having practiced in the ICU in England. Like that was not something that happened. Like patients didn't get denied therapy if they needed it, they got it. It was a clinical decision.
Right.
Like if it wasn't going to benefit them, we probably wouldn't do it, because then you kind of decide on a resource, from resource allocation among a population, what's going to work and what isn't. But it wasn't that there was an insurer telling you that you couldn't have it. So coming to the US and realize that there's a group of people who sit really outside of the doctor-patient relationship, who govern what can and can't be administered, was quite strange. And then the other thing I found really strange, I'll just reach for it if I can find it. Wait, this is kind of hilarious, but it's worth finding. Yeah. So I remember like trying to get my inhaler refilled, which is air tagged, by the way. As these things are so expensive that like if you lose it, you're like, $400 out of pocket. Mm-hmm. And someone was explaining to me what a pharmacy benefits manager is. And I was, in the middle of a CVS parking lot. And I was like, I don't even know what this is. I'm a medically trained person. I understand quite a lot about healthcare, but like I have no idea what the relationship of a PBM is outside of my
pharmacy
relationship with my insurance
manager. Most parents don't know about that. Yeah.
It's just like another layer. And so I started like realizing that there were all of these layers between the patient, the provider, and a good outcome, right? And over time, you just start realizing that none of these companies are in effect serious about really changing healthcare. And that's, a lot of people get very fixated on this idea of like a hypothetical population in the future who will benefit when we make healthcare more rational. But what we forget is that there are people here today who often are not getting that good outcome. Now, we founded Claimable because we couldn't believe the numbers. And moreover, they were real. So like, we looked at the size of a problem. There are 5 billion claims every year in the US. A claim is basically what's submitted on your behalf when, you go see a doctor. There's a lab claim, a clinic claim, and maybe a pharmacy claim. And 850 million of them roughly get denied. And then very, 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 very few of them ever get appealed. And we couldn't understand for the life of us why there was that disconnect until we tried appealing. And I remember like having to go and find a fax machine that worked. And it was like $18 to send a fax. I remember trying to like submit a letter and like going to the post office to send it and being shouted at by the guy in the post office because the address that I had for the insurer wasn't an address that accepted mail. And it was a real
Wow.
address. And you start
Wow.
realizing that there are all of these barriers. This is even if you can write the appeal, that even sending it is a nightmare. And so you're just like, okay, we've got to automate all of this away. And so we started doing this for rheumatoid arthritis. My mom had rheumatoid arthritis, so it's personal to me. We started doing it for Crohn's and ulcerative colitis, and we started doing it for migraine. And then, there was it's like a Saturday morning, not terribly long ago, that I get a text message at like 5, 6 a.m. from a guy on the East Coast. He's like, you got to see this LinkedIn post. And this is where our worlds start
This is
colliding, right?
recently, right?
Yeah,
This
this
was
was
very
pretty
recent,
recent. This was
right?
like November 11th, right? So
Right.
2024, November 11th.
Right.
So I get a text message, and it's this post from this chap called Logan Coulter
We all know
about his
now. He's famous in
right.
our community. Thank you,
He's
Mr.
yeah.
Coulter.
So from Logan, and about his daughter Gianna, and it's her handwriting is really what came up. And I've got some slides of this as well, so I can probably just share it if I can. Here we go. So I can show you what this looked like actually. So it started with this post, right? I don't know if you can see that.
Yes.
So
Yeah.
so there was the handwriting, and Logan told this, it was like really a plea to Cigna to do the right thing. And he was talking about how his daughter had deteriorated, and he'd really done as any parent could, like working, like coloring inside the lines of following every insurance guideline, working with the doctors, etc., trying to like mitigate every possible risk for his family. And it got a lot of traction. So what was this, like 2,000 plus reactions, 300 and something comments, and 302 reposts, right? And then we got involved and we started going bigger. And so I spoke to Logan that morning. I spoke to his wife, and I was like, well, let's write an appeal and get this overturned. And I'd worked on IVIG appeals previously. I'd worked on like one for small fiber neuropathy and like another one that we got overturned for, I think it was CIDP, can't remember, but I was pretty familiar. And we hadn't really done anything for children previously, but it more or less similar. So we just decided that we were going to get involved. And the whole team on the weekend decided, we're digging in, doing research on the evidence. I wrote immediately to the authors of the seminal research in the area, which was Mark Pasternak at Massachusetts General, and to Jenny Frankovich. Immediately,
Stanford, right.
Yeah, Stanford. Immediately got emails back from both of them. Mark was very kind and offered to talk at some point in the following weeks. Jenny's team reached out, and we got on the phone, and have had like an ongoing relationship of talking about how to improve things for the PANDAS community. We then started raising the stakes in the process of submitting this appeal. So the appeal ended up being like quite a lengthy document, and we involved Mark Cuban, and also Harold Perrineau, who I don't like. Harold, really wonderful man. He is an actor. He's on a show called From, which is on MGM, and he was also on a show called Lost, which was on ABC some years ago, which was like a massive hit. His daughter had PANS, and his family had been very involved in getting the law changed in California to mandate treatment with IVIG. And they worked with the community here.
Okay, great. Got it.
Yeah. And in the course of that, I should back up a little bit. In the course of that weekend of just kind of trying to understand more about PANS and PANDAS, I spoke to like 12 moms, like all over the country, and now I'm probably like somewhere north of like 20 something parents. And the commonality in the experience was quite striking, right? So you're dealing with a sick child, you have a family, you might have other children who you feel could be at risk. You have a job that maybe you can or can't do. You have a home that maybe you can or can't maintain, and you've got costs which seem uncontrollable. And then you're dealing with the stress of the insurance company telling you that you can't get this medication.
You know what? I just wanted to interrupt for a minute, Warris,
Yeah, of
because
course.
I don't, in my talking to some of the parents, I don't know everybody that's on this call now, but I I didn't appreciate, and I think a lot of people don't quite appreciate how unique what you're doing is in our modern era right now, utilizing AI, not for the distant future, but for the here and now. And I really didn't quite believe that you could do it when I first met you. I was like, who the heck is this guy? And Alicia Graham, who's also co-founder, is quietly sitting there in the background. You have this team that has created, entrepreneurs who created this new entity that really isn't there to profit greatly. You're here to actually do humanistic work, which I couldn't
Yeah.
quite believe it when I met you. So, I'm eager to have this whole webinar and to keep it forever housed on our website and to get claimable access, to your company on the front of our website, because more and more I'm going to be talking about you guys, because this was not accessible. What you're trying to do is so revolutionary and mind-blowing to me personally, having paid for 5 IVIGs. I'm really glad that you're doing what you're doing, but it's so unique. And I just wanted to emphasize that to the parents, that this really is a heroic effort, and I hope people will utilize it. Anyways, that's it.
Well, I appreciate that very much. And, we really did this because we'd just seen so much economic harm having been done
Yeah.
to these families already. Like, in the world of oncology, we talk about financial toxicity. This whole
I've
system
never
is,
heard that before.
yeah, it's a real thing
True.
about
Yeah.
like even if people are approved for care, there's this level of underinsurance that means that they can't afford to receive it because the insurance only covers so much, and then the patient's left with like a delta, which could be like 30% of these treatments, which can add up to tens of thousands of dollars a month, which they definitely can't afford. And for for PANS and PANDAS, I think there are like a number of hurdles, right? So one, it's under-recognized. We could talk a little about the AAP statement, which was ridiculous, but
Right.
we could talk
The
about that. It's under-recognized. It's hard to diagnose. You might have not enough providers in your state who will either recognize it or treat it, which was certainly the case with a family I've been working with recently. And then the other side of that is even if you achieve all of those, you get through all of those hurdles, insurance may not cover it. And that's like another big problem. So,
So can you explain how you were able to successfully help the Coulters? I know of two other families personally that you have helped, that I was holding my breath for a couple of months that they would ever have any success, and within about 2 weeks you overturned their denials, which is across state lines. That's another thing I wanted us to talk about, because it's so hard to find practitioners. And I just think you're the modern Robin Hoods, you and Alicia. You're just amazing. So, and Zach, right?
well, Zach's awesome as well. Yeah. So Zach isn't here, but he's kicking butt, making the AI work. So yeah, look, so the appeal, Logan's appeal was like written across the weekend. We did that one entirely manually. Monday morning, we convened at probably about 7 a.m. with the team, and nervously, I kind of told them that, like, look, we got to build something automated for PANS PANDAS because there's a whole community of people that really need this. And I think this would be huge for all of these families if we could get this done. And there was no discussion. It was like, yeah, okay, let's go do it.
Wow,
So
it's just
I want
amazing.
to say within like 10 days,
Mhm.
we had basically launched an automated experience, which involved like really taking everything we learned from Logan's appeal and then going forward. And in the intervening time, we were creating videos. Um, Logan and I were creating videos and editing them and posting them on LinkedIn and on Twitter and everywhere, and getting, I think we probably like got somewhere over like 1 million views in total, like I
No.
think across all of the platforms.
Oh,
Yeah.
wow.
The Idaho Statesman picked it up. They wrote a piece on Logan. At one point, I spoke to Diane Sawyer's people at ABC
Mm.
News who were tracking the story. People
Mhm.
Magazine were tracking the story.
Oh, I wish they'd done more pieces on it.
Yeah, I mean, me too. But Logan's story Gianna's case got overturned in about think it was in about 5 days. I
Yeah, it
want to
was
say it
fast.
could have been a bit longer, but it was about 5 days. We got it. We got it overturned, and the key learnings there, which are like some of the key learnings we'll come back to, would be that like one, like Logan is a fierce advocate for his family. And I think all parents need to be in this situation. Like, even when you submit the appeal, you still have to go further. And you've got to make sure that the appeal is socialized within the insurance company and within your employer. Um, and we'll talk about that. But Logan went to his employer, he spoke to his boss, he got everybody on side, and they were super supportive.
Mm.
Not every case is going to have the support of a huge celebrity backing, right? But we got in a way lucky on this one, to get that to happen. And we've had subsequent appeals which have gone viral in their own way, but probably without the support of Mark Cuban and other people being so public.
Well, and right place, right time, and it's a miracle. So thank you to everybody, and I hope Logan's daughter is going to heal. She really profoundly needs the IVIG. Some children are sicker than others, and I'd say she's
Yeah.
on the top end of ill. So
So I mean, this was like this was kind of a process, right? So day one, meeting the Coulters, and then 12 more families, and then we did a lot of research and development. And then by day 10 we'd launched it, and then by day 12, like, the PANS Research Consortium had provided a letter to go in every
wonderful.
appeal. So like this whole thing was happening in real time, and we were building this with the community, and the work is still ongoing. So we're still hearing from families. We monitor these appeals coming in and as they're getting filled out. um, and if someone has a problem, like, we normally get on email with them and figure out like where that problem exists, what could be better, etc., and figure out how we help them.
And the thing that I hadn't thought of, you mentioned yesterday, like this is new to me. I'm not an AI lady. So each person asking for help from Claimable is then building the intelligence of the machine so that it does a better job for the whole, claim appeal situation.
Yeah, I would say
Cumulative.
overall that would be the goal, but really what happens is that initially it's just helping us understand from an experience perspective, like, okay, so in this particular case, the mom has two denials and she doesn't know which one to upload to begin with,
I see.
because they got two denials on the same day. Okay, so then we have to start thinking about that experience problem. Or I don't know, they might take a different IVIG formulation, for example, the one we don't support. So then we have to figure out, like, okay, let's add that
Mhm.
as an IVIG option, for example. So those would be things that we might add. And then sometimes, it's just like little details that they want to get right and make sure come across well. Which we take a lot of effort to make sure that like these are as good as they can be before they go out. And we're constantly working to make sure that, because the parents are spending so much time giving us the information to go into the appeal, that the appeal really reflects what their story and journey.
How does the doctor work on this with you? Or like, can a mom or dad just give you their denial and then you don't need to talk to their doctor, or do you need the doctor on the phone to help with the process?
No, we've tended not to do that for the reason um, it's just too slow. So in rheumatology and other areas, we have a whole experience for providers where a doctor can refer a patient. And in times for PANS PANDAS, we'll probably deploy something that looks very similar to that, where a doc who's treating like a group of PANDAS patients or PANS patients can refer the patient. They'll be able to upload the letter of medical necessity, which is the support letter from the doctor saying why the treatment's necessary. And then the patient fills out their part of the appeal, and the whole thing gets shipped off together. Right now, what happens is that the patient comes to getclaimable.com, they click start appeal, they select the options for PANS PANDAS. If they have a denial letter, they upload it. And if they have a letter from their doctor at the end of the experience, they can upload that. And if not, they can go get it and come back and submit it. We would recommend
Right.
for these cases where IVIG is off label to have a letter from your doctor, because we think that's going to be important for approving it, because there aren't FDA guidelines, there isn't an FDA guideline saying that IVIG is cleared for use in
And I
PANS or
think
PANDAS
most
today.
I mean, I used to be really afraid to ask my doctors. This was, 15, 16 years ago. But I find now that they want to help. They used to be kind of afraid of the off-label,
Yeah,
whatever
I think
category, but they were getting braver.
we've seen it vary across specialties, to be honest. I've seen, the case with um, Medicare Advantage, which is like really on the other end of the spectrum of elderly patients, but docs are less likely to want to get involved in appeals.
Mm.
I've seen that, and it's because they're worried about the insurance company. Um, so that behavior exists, where I've had parents tell me like, oh, I don't think the doctor is being as supportive as they could be. I've had other families tell me that for different conditions as well. It's really mixed. So this is one of the reasons why we think that there needs to be an ability for a patient to actually exercise their rights to appeal. And patients have more rights than the provider has on appeal anyway. So, this is like a unique way of addressing appeals, and it's covered under the Affordable Care Act. If you're on a self-insured plan, that's governed under something called ERISA, which is the Employment Retirement Investment Savings Act. So it's covered under there. So, it's a pretty unique vector. And so that's why we think it's important.
I did see I mentioned to you that one of the appeal letters for a family, and I've got to say, it was, pardon my language, it was kick ass. I mean, it was really straight to the point, and even had some legal, wording at the end saying you need to do this because we can come after you for not approving it. So
We like to strongly encourage insurers to follow their own policies. Let's put it that way, and
I'd
and
have
be
thought.
consistent. Be consistent around that. I was dealing with one in Nebraska on the weekend. I was in a parking lot of a pharmacy, and I was on the phone with a mom, and she was saying like, they send me this thing and it's a denial, but I went all the way through their plan documents and I found all of this other stuff, and it looks like they're not even following their own documents. I'm like, amazing, we can use that. So this is an example of like, we learn from the community, and the community is telling us all of the ways in which we can make this better. So, that to me is like one of the best things about working on this specific problem, is that we're continually being educated.
I know you have more to say. I just want to interrupt one more time. Like this
Not at all.
community, this community, I've stayed for so long. I've tried to leave many times because it's hard and it's scary, and my kids are better. My daughter's relapsed a few times, but she's pretty okay. Very much okay now. And I just keep staying because everybody is really smart. They're really loyal. They really help each other. And it's like the essence of what life should be when you're going through a hard time. It's a really great community, and they're very intelligent parents who
I
persist.
mean, it's really different from some of the other areas we've been
Really.
working in. Yeah, I think so. I think with adults, like there's definitely a tendency to like isolate yourself, to not look at community and not be in any way public about what you're suffering with.
Well,
Uh, but
that's
when
why
it's
we
a
have our
child,
little Facebook groups, we can
sure.
share. But that's a whole other field that I want you to work on for us next year. Like, we all probably need post-traumatic stress disorder therapy. The families really struggle a lot emotionally and in marriages. And anyways, thank you for
Yeah, I mean,
complimenting us, but we struggle.
I, I saw a lot of these pyrrhic victories, but the difference with when it's a child, I feel like the community people come to the community and look for answers,
Mm,
in a way that kind of drives them to try things like Claimable, which is great, and it's given us the opportunity to support these families in their times of needs, which we see as a great privilege. To be honest, I mean,
thank
I
you.
actually don't I actually don't worry about the families that get approved. The second they get approved, I it's funny. I've made a lot of friends, but I don't worry about them at that point because
Mm,
they're on the path to recovery.
mhm,
I worry about the families who don't get approved, and those are the ones which like stay with me, Alicia and Zach. That we're always trying to figure out like the things that we can do for them that might help them.
mm.
At
Thank
the
you for
point where
caring. It's really moving. I mean, anyways.
I think I think it's sincere. I mean, Alicia, you can jump in on that one and tell me about your experiences at any time.
Um,
Hi.
I mean, I guess what I would just say is, I mean, it's been wonderful to meet so many families, and it feels like an honor to kind of be, introduced into their lives. I mean, the reality is these appeals are personal. And for a lot of people, it can be emotional to kind of think about and talk about the experiences they've had. And so we don't take that lightly. That it's a lot to share, but it matters, and we see you, we want others to see them. And I think that that's why it's important to us, is we want to make sure that these stories are stories that cannot be ignored.
I
Yeah.
this brings me to something that kind of ruined my Christmas vacation and New Year's vacation was the AAP memo that came out, American Academy of Pediatrics, expressing that PANDAS was a terrible and scary illness that affected people, but the next 30 pages says, for various reasons, we're not going to help these families for the most part. So, I had a bit of peace knowing that you guys exist and kind of stood up for us with that AAP memo. And just to let you know, I got another essay in the from Dr. Thomas. I can't think of his last name. Anyways, he's from Oxford in the United Kingdom, or King's College, the Royal College of Kings, something in England. And he
Not
wrote,
that fancy. I went there. Trust
yeah,
me.
okay,
It's
well,
not that fancy.
he's fancy, whatever. But he's a neuroscientist who studies schizophrenia and immune disorders
Cool.
associated with, psychiatric syndromes. And he basically wrote an essay that I just received last night saying, do nothing. Help no one, especially pans, mothers that are hysterical. I mean, it's 5 pages of this crap. And I don't know. I feel like you guys are here to kind of help us through these really painful
Sure.
things. And I'm very grateful. I mean, if some divine planning that you're here, just as these giants are kind of trying to pounce on us, as they say they're trying to help us, but they're now trying to stop us at the same time. So
It's interesting. So while that was happening, I was in the middle of fighting United Healthcare on April Beck's appeal for her daughter Emily, which was like another case that,
PANDAS. Yeah.
which was, yeah. And so that was an interesting case. And I was like worried that, that statement would be in any way prejudicial toward the appeal,
The
because
AAP
it was,
statement.
yeah, because I mean, in theory, the problem is that you put out a position statement from AAP, which is effectively unsigned by any humans,
I know.
and
That's a robot.
someone takes it as a guideline, right? So like then someone says, oh, well, the AAP guideline, you know, says this. It's like, well, no, it's an unsigned position statement. They won't say who they spoke to. It's hard to argue with, but at the same time, we got April approved for her daughter
Good.
Emily, and then in the process of that, we're going to hold UHC to this. They said that they were in the process of changing their IVIG approval criteria for all PANDAS
Really?
so then it wouldn't be a battle for these families.
Wait, can you just say that one more time? They're in the process
Correct.
of doing
You
what?
heard it correctly. Because of the appeal, they're in the process of changing their criteria for PANDAS approvals.
Oh my gosh. Wow.
So,
I've never heard that in 20 years.
I
Well,
mean, great. I mean, so, good things
great.
can happen. So, so be it. And we intend to hold them to that. We've had major media, like, elite media effectively cover some of these stories as well. So, there's a big investigative piece that is currently being
Oh,
put
really?
together, which will feature PANDAS. So there'll be more visibility on that, which hopefully will contribute to this debate about the realness of this condition and the necessity for treatment.
On a side note, I'll just mention
Yeah,
Politico reached out to me right after you called me on November 11th and is doing a piece.
yeah,
Do you know that?
yeah. Well, I
Pretty
didn't know
nice.
they reached out to you, but Ruth Reeder is a really good
Okay.
journalist. Um, she covered some of Logan's case because I mean, Logan basically turned into super dad, and I think he got like 3 state senators to scream at Cigna for their denial. So from the political standpoint, and this was around the election as well, it was interesting to Politico to cover that, like, politicians were getting involved, and this was before the Brian Thompson murder as well. So, a lot's happened since we got involved with PANDAS, including like, insurance denials now being the one of the preeminent issues in American life, being discussed in the media every day.
It's extraordinary. You didn't know that this would happen, obviously.
No.
But when we had talked, I'd said I felt like there was a volatile aspect to the insurance. Remember, the insurance
Yeah.
companies in America. But I was a little afraid of doing this interview today because it's a really big deal, what's happening, not just to the PANDAS families, but to the whole United States. And I don't know what's going to happen in the next couple of years, but I mean, we'll be along on this train ride with you. But I think it's going to get, I hope you get a lot of investors and that Claimable keeps growing.
My view is that DC is going to be as unhelpful as it's been forever. So it'll be fundamentally out to lunch for a long time. So I wouldn't expect there to be any political solutions that come our way. The solutions are likely to be caused by people working locally, supporting families and communities, much in the way that we are, and helping people have agency in situations where they're being otherwise denied. So that's where we're going to focus our effort versus lobbying, DC senators who are, potentially being paid by insurance companies. That's not going to be helpful in our view. So we'd much rather spend our time, working on impact and then figuring out how to scale it. And again, that comes back to helping people in the here and now.
Love having you on board. It's pretty great. More than great. So keep going with we have some questions at the end too, so let's get through.
Yeah, sure. So we can get through these pretty quickly. So we designed Claimable to be kind of like a friendly experience, and to be so much of this feels like soul crushing, to be honest, when you're dealing with a denial and you've got nowhere to turn, and the insurance experience is profoundly unfriendly. It's old forms, it's photocopies, it's portals that seem to go nowhere, telephone trees, to the abyss. We wanted to make it feel like a proper kind of more optimistic experience, dealing with appeals. So, a lot of that was kind of went into design and thinking about that. And then, what are the things that go into an appeal? And so there's a bunch of things, it turns out. So we recommend sending appeals to a bunch of people. And my experience is the following thing, and I'm just going to say this. If you send your appeal only to appeals at insurance company, it will get denied. I guarantee you.
Really?
They will ignore you. They will not recognize it as being urgent. They will not do any of that. They will just, no one's watching. It will just get denied. So my advice is always to send it to a regulator who's in charge of looking at that insurance company, whether that's at the state level or the federal level. So we've seen Department of Labor get involved on employer-sponsored plans numerous times. We've seen governors and attorney generals kick off state-level investigations. We've seen the Department of Insurance get
the Department of Insurance. Yeah, I think that's the most powerful one. Well, and the attorney general.
Yep. Attorney generals want to be governors want to be presidents. So there tends to be this natural kind of hierarchy.
But when I hear this, for me, a fatigued mother who's been fighting PANDAS for a decade, my kids, I wasn't afraid. Well, when I looked at your website and saw how to do this, it wasn't scary. I just wanted parents to know. And Amy Azarian, who might be on this call, who just got her appeal approved, said, she called Zach and he helped her figure out who to, email, because you don't know your attorney general in your state. So you guys help us through some scary parts or intimidating parts.
Yeah, it shouldn't, we try to make it as non-scary as possible through the experience. So we have a curated address book of mailing addresses, and we try and fax to people as soon as we can, on the basis that it just starts the clock for them to
review it for us. You fax it for us.
Yeah. we do it for you, and it starts this kind of 72-hour approval timeline. Like most of these PANS cases and PANDAS cases are very serious. Sometimes you've got kids who aren't eating. Deterioration could be fast. Like I've talked to Susan Manful a bunch about this. She was away this weekend and wrote a letter to support a family, which is just incredibly kind. And that's a slightly special appeal case that we're going to submit in the coming days. So very grateful to her. But she will tell you that these kids can deteriorate really quickly. There's a lot of people on this.
Children.
Yeah. So the things we include: the expanded reach. If you're in a self-insured plan, send it to your employer. Do not send it to the most junior person in HR. They will not be able to make a decision. I would send it to the CEO. I would send it to the head of human resources. I would send it to them. I would not send it just to HR, the lowest person in HR. They will not make a decision. We include the personal summary. We normally point out where the insurer is out of compliance with our own policies. We have a list of precedent that we're building. Like each one of you, your cases can be anonymized and used to help another family who has a similar denial. So that is very helpful. So it's the community helping the community, which is great, which is kind of like the truest form of altruism in a way, but this network effect just builds. And then it becomes kind of undeniable. Like it's really clear the insurers are doing the wrong things. And then there's a host of studies, right? So the studies that the AAP statement didn't include were the Melamed study in 2024 and a bunch of others, which showed the benefit of IVIG. So we cite all of this key research. I get sent research all the time by various people at Stanford, which are just really helpful about like what happens if you deny IVIG or withhold it, and how it can increase risk to the child of developing future autoimmune conditions. So we make those arguments in the letters. We highlight the reasonable steps. And I was on a call with Sarah Lemley before I came here, and she was asking about step therapy. And most of these families inherently been through step therapy. Like they've tried antibiotics, they've tried steroids. They, if they're, with, Dr. Kovacevic, they've probably done a tonsillectomy and adenoidectomy. So they've been through a stepwise progression of ruling out things which are less expensive. And then we highlight the laws that, ideally, and this is written from a, layperson perspective, like Claimable is not practicing law, we're not lawyers. So we're kind of writing at the broad level of like, these are broad laws that protect me, which include the Affordable Care Act, ERISA, and various state laws mandating that you should comply with, allowing step therapy exemptions or treatment with IVIG. And then we ask for the claim file. And this is a big civil rights thing, and I'll stop monologuing in just a second. But like, you take any chronic disease and you want to know how decisions been made in your interest, right? So that could be a denial, an approval, whatever. If you're going to be living with that chronic disease for the rest of your life, you ought to know what people have been saying about you behind your back. And
you can request the claims file. I didn't even know that was a thing.
We include it in the appeal. So we basically use it as there's carrot and stick. The carrot is approve the appeal. The stick is if you don't approve it, I want the claim file within 30 days. Because if you don't give it to me within 30 days, there are penalties. There's actually $110 a day, which can be enforced by the Department of Labor, and it's unlimited.
Oh my God, I had no idea. Wow.
Yeah, so if the insurance company doesn't provide the full claim file, which can include audio, discussion notes, any internal communications, whatever, yeah, within 30 days, there are penalties that can be, enforced by the Department of Labor. So
wow,
it's interesting. So, and then we cite all of our references, and and we have a bunch of attachments, which include very helpfully this letter from the PANS Research Consortium, which we're incredibly grateful to C-Suito and Jenny Frankovich and everybody that helped kind of whip that letter into shape. To include it in the appeals which are going out on your behalf. And so like, look, our part is like the least of it. We took an experience that for the most part we already built, we adapted it for PANS PANDAS. We just want to do a good job.
Good. Okay. Is there more? Yeah, go ahead.
I mean, sure. I mean, this is kind of what the experience looks like for people who haven't tried it. So like, this is the adaptation. So like, we'll cover like, basic details about your insurance. We ask questions and we make as much of a selection as possible. There are areas which are text boxes where we ask people for, examples. There's then a moment where you review the letter. If there's an issue, you can, if it looks good, you click looks good. If there's an issue, you can say report issue. That then comes to us in support. We then dive in at that point, and then if you're ready to go, you have a moment where you select who it goes to, and we highly recommend including people like your employer if you're on an employer-sponsored plan, because very often they'll be on your side and they have no idea what the insurance company is doing or not
To
doing.
you. Yeah. And because
Yeah.
we grow silent, I mean, in the statistic that less than 1%, I think it's 0.2% of people appeal denials. So it's exciting to know that they can be, that people will actually listen to us, be interested.
Yeah, I've only seen one case actually where an employer took an adversarial position to a patient, and that was, and the way they did that was by doing nothing at all. And that was an employer who was undergoing a bankruptcy proceeding, who didn't want to spend money. But the rest of them, like in our experience, they've been super supportive when they actually know that the insurance company isn't doing what they should be doing.
Insurers are dictating care through denials. To fight back, always appeal.
That's our advice.
Yes. Well, you helped me with a personal, my own autoimmune disease. You encouraged me to fight back. And so
as you should.
So I did. Well, I had given up. This was just a couple weeks ago. So I understand that feeling of not wanting to keep fighting. So are there, do we have time to go over the questions that some of the other parents might have? Alicia?
Of course, let's do it. So I've been answering some of them as we go. But I think, one question, actually, Diana, this would be for you. There's a question here about what about fundraising and what can donors do to support?
Well, they can contact me at PANDAS Network. I mean, there's several PANDAS, PANS nonprofits now, but donors can help us fund research that is not being funded. We only have about $3 million right now that's being used by Yale only, and none of the other researchers at Columbia, Georgetown, or at Stanford have any funding to go forward with research. So that's another frontier that we need to push through.
I just want to pick one of these out of the queue. So Karen Brown writes that her daughter, also Gianna, has been fighting PANDAS PANS for 8 years. It's getclaimable.com that you want to go to, not claimable.com. It's kind of confusing, but apologies for that. So getclaimable.com, and you should find something pretty helpful there.
And then Karen, I know Karen, you can call me Karen. So
yeah, and, absolutely. And Karen, like if BCBS are denying this, like, reach out to me. I'll be happy to help you beat them up and get them to do the right thing. And then Amy Prochaska writes something. Sorry, I just lost it. Can I submit my 2 IVIG appeals that were overturned? Would that be helpful? Yes, I will absolutely take any precedent that can help us overturn other patients. That is incredibly helpful. We promise to anonymize it, use it sensitively, but use it in a way that helps other people. That is the truest form of altruism in this case. Angela Tang. Hi, Angela. Long time listener, first time caller.
Dr. Tang. She was very pivotal in passing the IVIG law in California.
We're buds.
Well, I'm just saying it's for the other parents.
Yeah, I know. She's Dr. Tang is incredible. And incredibly grateful for her help here. So HealthNet, their IVIG policy 2021 to 2024, they're aware of the tsunami of pressure coming and continue to resist yielding. Only state-by-state laws are written. Maybe we can get HealthNet to follow United and change their policy. Absolutely. I think when this major media piece comes out, I think it's going to be a lot of pressure and a lot of visibility on PANDAS. That's my hope. and we'll
When
continue
is
to
this
fight them.
major, when's this piece coming out? Like, is it TV?
I've been in touch with the journalist every day.
Is it like
Been
on the news, CBS? You
No,
can't.
it'll be in a big print outlet. So it'll be good. It's a big investigative piece which covers a PANDS family and their battle to get covered, plus a few other things, and really goes into the impact of these denials and how they're harming families. And I can tell you that it's been approached with a real kind of curiosity and empathy about what what you families are going through. There's a real understanding there.
Well, and I think, too, what I believe is that we're at the tipping point of understanding neuropsychiatry and neuroimmunology for many, many illnesses. So there's going to be a ton of pressure. Thank God we have children and not adults that we're trying to push forward. But these children are sort of blessedly, opening a larger, area of research that will help a lot of people over time, I think. But there's going to be a lot of pressure because it's a big deal to shift belief systems. And I think it's not that scary. I don't know why the doctors are so afraid of what we're doing. I think it's really neat to see people get better pretty easily.
Yeah, for sure.
I've got to convince them.
I got a few more questions in here, which I'd love to get to, because this is, interesting. So Rick Taylor, you got a couple in here. So have we tried TriNet for other things, not for PANDAS, but sure, we could appeal that. I didn't see that as being a problem. And is it for IV antibiotics or just IVIG? For PANDAS, it's just IVIG. That's where we've started. Now, I've heard that rituximab could be an area that we would expand into, etc. We appeal for rituximab for rheumatoid arthritis and Crohn's today in adults. We're really just right now focused on making sure that the IVIG appeals are as good as they can be before we start moving down the stack into other areas where we can help people. We have to kind of marshal our resources into things we can do. A couple of other ones in here. So Dana, we're denied IVIG on appeal by Cigna for a severely ill PANDAS son, forced to pay out of pocket. We're in New York. Are we able to file an additional appeal through you? And is there a time limit? The time that would be specified by your plan, it's generally 180 days, depending on how you got your insurance. So, I'd be interested to talk to you and learn more. If it's employer sponsored, then involving your employer would be what I would recommend in the next appeal. And by the way, just for the record, we've had cases where the patient has been out of appeal rights and it's being kicked over to independent medical review, and we're saying no, we're going to appeal it back at the insurer because you guys should make a different decision. And we've motivated the insurer to do so pretty much every time.
Wow. Okay.
So I would, and in terms of paying out of pocket, this isn't the case for everyone, but we've seen this where the insurer will actually make the patient whole for incurred costs, especially if it's an employer sponsored plan. You can ask for that, but I'd ask for the approval first, and then I would push them for costs. Wow. as almost a separate argument. Let me see. Zach's a rock star. These are facts. I would agree. Love you, Diana. Agreed. So, Alicia, any you want to pull out?
Similar to you asked the question about if you run out of your appeal rights, I think maybe just addressing what if the appeal period expired. And I think, maybe I can just say broadly so people know, typically you have 180 days. That said, you can ask for an extension at any time, stating that there are extenuating circumstances. And generally speaking, caring for a severely ill child seems like a pretty good extenuating circumstance to us. So within our experience, we actually ask a question if any of these special situations apply to you, and one of the options is appeal period expired. If you click that, we add an argument to your appeal automatically that says, I'm asking for an extension, give it to me.
You guys have the caregiver burden study that Stanford did about the burden to PANDAS families is beyond that of higher, the rate of stress of the family is higher than that of taking care of a family member with Alzheimer's. It goes out of the stress range.
Yeah.
So
Doesn't
you could
surprise
add
me.
that to your appeal.
It doesn't surprise me. I mean, yeah, I mean, look, we hope this helps. I think this is kind of where we come out on this, is that we built something that we hope like alleviates some of the burden that's being put upon these families, and we'll continue just working with you to make it better. If there's something that isn't quite right in the appeal, we'll see it in support. So if there's something you think should be, expressed more fully, or something we didn't get quite right, let us know. We'll make it better. And we're going to try and continue to make it more and more automated, so then these things don't happen for the next group of families and the next group of families. So by telling us what's wrong with something, you in effect, you're making it better, and we appreciate it.
Thank you. And then I just wanted to mention the world as a whole. What we do in the US seems to really help other countries think about how to help the kids that they've got, like in South Africa, the UK, Sweden, Iceland, Denmark. There's a lot of issues and in South America. So anyways, rock on, American, parents, and thank you, Warris and Alicia, for helping us.
Oh, our pleasure.
Yeah,
So,
we can get through some of the other questions and maybe even follow
okay.
up here. But I think that's a lot of them. I guess maybe one other thing that could be helpful for both of you to sort of clarify. I think there's some questions in here just around like state laws, what state law apply, when state laws apply. So Warris, I don't know if you want to just share kind of briefly how that all works.
Oh man. So insurers. Oh God.
I'm glad
It
somebody
depends.
else
It
is
depends.
letting it out.
It depends on the insurer, right? So a lot of like 50% of people in this country are in self-insured plans, which means that their insurer is their employer effectively. They're in an employer. They work for a company that's 500 people and up. The employer actually is the insurer of record. The insurance is administered by Anthem, United, Cigna, Aetna, whoever, but the actual insurer is the employer. If that's the case, it's really governed under federal law, under ERISA, which is the Employment Retirement Investment Savings Act. Now, there are far fewer protections under ERISA than there are under state law, generally, because under state law, there are all of these mandates in the 12 states that have passed, legislation to say that IVIG should be covered. Now, the insurers know this, and they will often kick things to the federal level and say, well, we don't have to follow state law because we're governed under ERISA, so go with God. Now, that is not helpful. That is not always the case, though. So we've seen it in other areas where we cite federal protections like the Mental Health Parity and Equity Act, MPHEA, as well as protections at the state level. And we've seen it where governor's offices have said, this is federal, we won't get involved. And we've seen it where governor's offices have gotten involved even after an approval, where they've kicked off like a multi-state investigation into an insurer.
Wow.
So
Multi-state.
we multi-state. So we've seen that. So I'm curious, to see how that evolves. I mean, the answer is, as more states, pass laws, it's going to be harder for the insurers to say that, that the state law doesn't matter.
Right.
That would be how I would look at that. Any other questions from? Oh, Tammy, you were a long paragraph here. Absolutely, I think there needs to be pressure on institutions to make full disclosures. In Atlanta, denying a condition exists when patients are suffering, and there might be a treatment or condition another facility is treating, researching is unconscionable. Yeah, so April had this problem in Atlanta, and she had to drive to Arkansas for treatment, just FYI. I also recommend patients realize that it's up to you to go to a facility and help. They don't know what's going on. Check your hospital's rating. Ratings matter. Our hospital is ranked number 49, and both CHOP and Cincinnati Children's are at 1 and 3. They help my child heal and avoid unnecessary treatments, including lifelong overuse of meds. Yeah, absolutely. Thanks for your interest in educating these parents as when you're in these situations, want to avoid unnecessary steps. We're going through at this time, we're going through my daughter's suffering. It felt like we're in charge of driving the bus for quality medical care whilst trying to survive. Yeah, absolutely. Like this, it's ridiculously hard to be in your position. Ridiculously hard. So, you know, thank you for helping each other. Thank you for being part of this, and like tell us any which way we can be of service.
You know, one of the things to the parents that are on this call, about 70 parents, is that there's a lot of parents I see on the Facebook groups that are afraid to even try to do IVIG or try to do serious medical interventions because they don't think they can have access. So this is a stepping stone. We're creating a stepping stone for a lot of people.
Yeah, I mean, I've genuinely seen this, that people become fearful of getting care because they're worried about getting denied, right? And they feel judged. I mean, I feel that way when I go up to the pharmacy counter to refill my inhalers. I'm worried I'm going to be given a denial, and then I'm going to have to like deal with the insurance company. And this is me, right? So I know how to fight an insurance company, but it's scary for me. And I feel like stigmatized for having a disease. So I can only imagine what it's like to have a child who has, you know, effectively a mental health condition. And one, you don't want to be super public about it because it's the privacy and safety of your child. But then on the other hand, it's an under-recognized condition. And then you're being told by the insurer you can't have the thing that is the lifeline to help them. So it's unfair in any number of ways. We're hoping we can make it a little bit more equal. There are ways to have strength in numbers, which shouldn't involve like a massive social media campaign always. But, if we can get, big media attention on some of these cases, I think it becomes harder for, groups like, the American Academy of Pediatrics to continue to make it really difficult for patients to get diagnosed and treated.
We finally have one advocate in you guys, and a few brave doctors and a lot of brave parents. So it's really on a professional level, having you guys standing up for us it's good. It's great. It gives us a little bit more muscle.
I think there's a lot. I mean, like I was talking to, Susan Manful. She's a powerful advocate. You're a powerful advocate. Sue Sweeto's doing amazing work. Mark Pasternak. There are a lot of people who are pushing against this. Writing responses to this AAP statement. So, I mean, I think it's going to come out over time. There'll be more and more studies that show IVIG is beneficial. Insurers, may cherry pick studies, so it'll then be up to us to be in a position to show them other studies which are better evidence.
We funded parents funded an IVIG study that looked at the RNA, not the DNA, but the RNA of the children before IVIG when they were really sick and after IVIG. And they color coded it, like red was bad and blue was happy, difficult, disrupted RNA, and blue was happy RNA. And before IVIG, the RNA was red. And after they followed these kids for 3 months, their RNA became peaceful and blue. There's still some issues with some of the kids, but they could persist and they could measure what they were healing in the children. We haven't, it's not published yet, but that's a really cool study.
Amazing. I don't know if we got time for another couple of questions. We got Karen McGuire here. Our insurer is a self-funded plan, but when we contacted the Department of Labor, they stated that they were not covered under ERISA, nor do they seem to be under the laws of the state of Arizona. Ultimately, the employer decides and governs changes. How do we go about appealing this process and start the appeal process again in February? Is this be the end of 180 days? I would just ask you if we could talk. I'll put my email in here, and you can drop me a line.
Uh-oh, look out, Warris. Coming for
That's
you.
Fine. Drop me a line. And we'll chat. I'm curious to know how that would even be possible for someone not to be governed federally and not to be covered under the state. They'd have to be one of the two. It could be that they're in a weird self-funded arrangement where they are level funded or a captive type plan, but they would still be under ERISA. Okay, now we've got our HMO policy requires referrals, but only Dr. Kovacevic specializing in treatment of PANDAS cases administering IVIG. Due to the severity of the symptoms, we could not wait for the referral process and official diagnosis. That would have delayed treatment until late January or February. Is there a way to get our HMO to approve the treatment we've already paid for? Alicia, thoughts on that?
So you can do post-service denials, post-service appeals. So that is a thing that is true. Statute of limitations on time, though, is tricky when you probably get outside of a year, just, kind of realistically speaking. But certainly, it's not easy to do automatically in our system, but you could start an appeal in our system and then click a support request and we could get kind of the specific language you need for that added in. But it'd really be the same appeal. We just add language saying I've already paid for it and I'd like to be reimbursed.
Yep.
I like that.
Great. And I don't know if there was, I don't know, any other burning questions here.
The only other, and we should probably wrap up. We're 5 minutes over. But there is a question about FDA approval. So I think maybe just touching on how likely it is for there to even be FDA approval for, more rare diseases and just like the realities of that might be helpful.
FDA approval of IVIG?
Yeah, we mentioned, off-label. So there's a question of when it would be FDA approved. So I think maybe just speaking to kind of how that works for us might be helpful to people.
I just want to say something, Warris. We tried to do this with the Octapharma trial with IVIG. It's suspended at the moment as they're reviewing the, results. But the FDA it was supposed to be a federally funded, approval process.
See what it becomes. We'll see what it becomes in the next couple of months. I don't know. I would say that the FDA approval, FDA clearance for PANS is likely, my guess is it's going to be hard and it's going to continue to be an uphill battle unless someone's really motivated to do like a well-controlled study. And that would need to be one of the manufacturers, ideally, who would put something in place that would meet the bar of approval. So it's likely to stay as a recognized off-label use that's going to be a very slow screw to turn. It'll probably be slower than actually appealing insurance, to be honest. If it happened, that would be great.
Point to make there, and I know, Dana, you're working on changing that, but it has nothing to do with PANS or PANDAS. It's for any rare disease, that it's very difficult. FDA approval requires large, controlled, costly studies. And so a lot of rare diseases are treated off-label. It's just a common reality. And I know, Dana, you can speak to how you're working to change that, but it's not specific to this. It's just a reality of the FDA.
Right. Well, hopefully the Octapharma trial, which will be international, will rectify whatever or review whatever the issues were, and they'll be able to, continue. They were willing to invest, I think, something, several $1 million, like more than $10, $20 million in the Octapharma IVIG trial. So hopefully they'll be successful. I don't know what's going on right now. I don't have the details.
Well, very much appreciate the opportunity to talk to you all and to help this community. Keep us posted if you need anything from us. I tend to be very contactable, so always happy to learn more.
This is like the best start of the year ever that I've had in 20 years, except when my babies were born. This is like a really happy conversation for me. Thank you. Thank you.
Well, wonderful. And thank you, Diana, for your support.
You're welcome. Well, we'll have the video up at some point soon, and then we'll have a permanent link on the front of the website so people can review this forever and ever.
Amazing. Happy New Year, everybody.
Thank you. You
Thanks.
too. Happy New Year.
Bye.